Diabetes, a condition affecting millions worldwide, is often mistakenly linked solely to sugar intake. While dietary choices play a role, the reality is far more complex. At its core, diabetes is a chronic metabolic disorder characterized by consistently elevated blood sugar levels. This elevation stems from the body's struggle to properly manage insulin, a vital hormone responsible for regulating glucose in the bloodstream. Imagine insulin as a key that unlocks cells, allowing glucose to enter and provide energy. In diabetes, this key either isn't produced in sufficient quantities, as seen in type 1, or the locks on the cells become resistant to the key, a hallmark of type 2. Gestational diabetes, a temporary form occurring during pregnancy, also impacts insulin function. Understanding these distinct types is crucial because each carries unique risk factors and requires tailored management strategies. Factors such as genetics, lifestyle choices, and overall health can contribute to the development of diabetes, making it a multifaceted condition that demands a comprehensive understanding beyond just sugar consumption. Regular blood glucose monitoring is essential for managing all types of diabetes, providing valuable insights into how the body is processing sugar. Section titles: The Real Culprits, Insulin Resistance and Other Factors. Section plot summaries: While sugary diets can contribute to weight gain and increase the risk of type 2 diabetes, the primary drivers are often insulin resistance, genetics, and lifestyle factors. Insulin resistance occurs when cells become less responsive to insulin, leading to a buildup of glucose in the bloodstream. Other contributing factors include obesity, physical inactivity, family history of diabetes, and certain ethnicities. Key elements: insulin resistance, obesity, physical inactivity, genetics, ethnicity. While a diet high in sugary treats can certainly contribute to weight gain, indirectly increasing the risk of type 2 diabetes, it's essential to understand that the root causes often lie elsewhere. The real culprits behind the development of type 2 diabetes are typically a combination of factors, with insulin resistance taking center stage. Insulin resistance happens when cells, like muscles and liver, become less sensitive to insulin signal, requiring the pancreas to produce more and more insulin to achieve the same effect. Eventually, the pancreas can't keep up, leading to elevated blood sugar levels. Obesity, particularly excess abdominal fat, is strongly linked to insulin resistance, as fat cells can interfere with insulin signaling. Physical inactivity further exacerbates the problem, as exercise helps improve insulin sensitivity. Genetics also play a significant role, making individuals with a family history of diabetes more susceptible. Additionally, certain ethnicities, such as African Americans, Hispanic Americans, Native Americans, Asian Americans, and Pacific Islanders, have a higher prevalence of diabetes, likely due to a combination of genetic and environmental factors. Therefore, while reducing sugar intake is beneficial, a holistic approach addressing these underlying factors is paramount in preventing and managing type 2 diabetes. Section titles: Managing diabetes, a holistic approach to health. Section plot summaries: Managing diabetes requires a comprehensive approach that includes lifestyle modifications, medication, and regular monitoring of blood glucose levels. Lifestyle changes, such as adopting a balanced diet, engaging in regular physical activity, and maintaining a healthy weight, are crucial. Medication, including insulin and oral hypoglycemic agents, may be necessary to control blood sugar levels. Regular check-ups with healthcare professionals, including endocrinologists and diabetes educators, are essential for effective management and prevention of complications. Key elements: balanced diet, regular exercise, blood glucose monitoring, medication, insulin, oral hypoglycemic agents, endocrinologist, diabetes educator. Effectively managing diabetes requires a multifaceted approach, combining lifestyle adjustments, medication when necessary, and consistent monitoring of blood glucose levels. Lifestyle modifications form the cornerstone of diabetes management. Adopting a balanced diet, rich in fruits, vegetables, and whole grains, while limiting processed foods, sugary drinks, and unhealthy fats, is essential. Equally important is engaging in regular physical activity, aiming for at least 30 minutes of moderate intensity exercise most days of the week. Maintaining a healthy weight also plays a significant role in improving insulin sensitivity and overall health. In some cases, lifestyle changes alone may not be sufficient to control blood sugar levels. Medication, including insulin injections or oral hypoglycemic agents, may be prescribed to help the body utilize insulin more effectively or to reduce glucose production. Regular blood glucose monitoring is crucial to track the effectiveness of these interventions and make necessary adjustments. Furthermore, regular check-ups with healthcare professionals, including endocrinologists, who specialize in hormonal disorders, and diabetes educators, who provide guidance on self-management techniques, are essential for preventing complications and ensuring long-term health. A proactive and collaborative approach, involving both the individual and their healthcare team, is key to successful diabetes management. While a diet high in sugary foods can certainly contribute to weight gain, which in turn increases the risk of developing type 2 diabetes, it's crucial to understand that the condition is far more complex than simply eating too much sugar. The real culprits behind diabetes often lie in a combination of insulin resistance, genetic predispositions, and lifestyle choices. Insulin resistance is a condition where your body's cells become less responsive to the effects of insulin. Insulin, as we discussed, is the hormone that allows glucose to enter cells for energy. When cells become resistant, glucose struggles to get in, leading to a buildup of sugar in the bloodstream, the hallmark of diabetes. Several factors contribute to insulin resistance. Obesity, particularly excess abdominal fat, is a significant driver. Fat cells, especially those around the abdomen, release hormones and other substances that interfere with insulin signaling. Physical inactivity also plays a major role. Muscles are major consumers of glucose, and when we're inactive, they become less sensitive to insulin. A sedentary lifestyle contributes to insulin resistance and increases the risk of developing type 2 diabetes. Furthermore, genetics can significantly influence your susceptibility to developing diabetes. A family history of the disease increases your risk, suggesting that certain genes make some individuals more prone to insulin resistance. Finally, ethnicity also plays a role. Certain ethnic groups, such as African Americans, Hispanic Americans, Native Americans, Asian Americans, and Pacific Islanders, have a higher prevalence of type 2 diabetes, indicating a genetic or environmental predisposition. Recognizing these multifaceted factors is crucial for understanding and addressing the root causes of diabetes. Effectively managing diabetes is a multifaceted journey that extends far beyond simply watching your sugar intake. It requires a holistic approach, combining consistent lifestyle adjustments with medical interventions and diligent monitoring. The cornerstone of diabetes management lies in adopting a balanced diet. This means focusing on whole, unprocessed foods, emphasizing fruits, vegetables, lean proteins, and whole grains while limiting sugary drinks, processed snacks, and excessive amounts of saturated and unhealthy fats. Coupled with a healthy diet, regular physical activity plays a vital role. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could include brisk walking, cycling, swimming, or any activity that gets your heart rate up. Exercise helps improve insulin sensitivity, allowing your body to use glucose more effectively and manage your weight, further contributing to better blood sugar control. Regular blood glucose monitoring is also essential. It provides valuable insights into how your body responds to different foods, activities, and medications, allowing you to make informed decisions about your diabetes management plan. In many cases, medication is necessary to maintain healthy blood sugar levels. This may involve insulin injections or pumps for type 1 diabetes or oral hypoglycemic agents for type 2 diabetes, all prescribed and monitored by a healthcare professional. Finally, schedule regular check-ups with an endocrinologist, a doctor specializing in hormone disorders, and a diabetes educator, who can provide personalized guidance on diet, exercise, and medication management.